Hi, my name is Ashita Batavia. I am a board-certified infectious diseases doctor. I practice at New York Presbyterian Lawrence Hospital. I'm also an assistant professor of medicine at Cornell and one of the board members for Neighbors for Refugees. I'm really excited to spend this time with you and answer some of your questions on COVID-19. So the first question that I've been asked is the virus still dangerous? And the answer is yes. So as of today, the actual way that the virus spreads has been slowed down in New York because we've done a really great job of keeping separated, so socially distancing and wearing face masks. That doesn't mean that if we stop doing these actions that we aren't still at risk for getting the virus. And if you're infected, the way that the virus can affect your body, that has not changed from the beginning of the pandemic to now. We're optimistic that there will be new vaccines and therapies, but that looks like it's still some time into the future. So in the meantime, it's really important to do what you can to reduce the chances of getting sick and getting infected and of infecting others. The next question, do I need to wear a mask? Why? My friends say we don't have to, and I see lots of people without them. This is a really good question, and I think that there is a lot of misunderstanding in our community where people have made the assumption that the decision to reopen means that the virus is no longer dangerous. In fact, those are very separate things. We should continue to go about our lives in a very cautious way. So if you are venturing out, if you are going to work, as much as possible, you should still stay 6 to 10 feet away from other people. And additionally, you should try to wear a cloth mask. The reason for the mask is that it protects other people from you and you from other people, but more so the former. So in effect, a lot of people can be infected with COVID, and before they show symptoms, they can infect others. And there's no way to know definitively if you have the infection or not. So as a way to protect those around you, you wear a mask. And if everyone else around you wears a mask, that also serves to protect you. Think of it as an act of kindness. What is the best way to wear a mask and keep it clean? This is a great question. So I generally recommend, and consistent with the CDC guidelines, that you have a cloth mask. The cloth mask should cover your nose and your mouth, and it should fit comfortably, not too snug, but not loose enough that you feel like you could just breathe completely around it. And the mask, since it's cloth, it's ideal if you wash it every time you use it. So when you get home, put it in a washing machine, hand wash it, whatever feels most comfortable, and then hang it up to dry and reuse it. Is it safe to use public transport? This is a great question. This, again, it comes down to the same basic rules. As much as you're able to on public transport, try to maintain distance from other people. If there are ways that you can think about planning your route to somewhere so that you can go during less crowded hours, or if you can minimize the amount of time that you're on public transport, then that's ideal. All of these actions that you take are designed to reduce the chances that you become infected from the virus. Because, as we mentioned before, unfortunately, the virus is still quite dangerous, and the level of danger to you today versus in April hasn't changed that much, hasn't really changed at all from the perspective of the virus. Should I wear gloves? Is sanitizer okay instead? This is a great question. So I see a lot of people who wear gloves. Gloves are surprisingly difficult to use. If you're wearing gloves, but you touch a bunch of other things and then you touch your mouth and nose, you could risk infecting yourself. The glove itself won't necessarily protect you. So I generally don't recommend that non-medical professionals wear gloves in a regular life. When I go to the grocery store, I don't wear gloves. What you should try to do is use an alcohol-based sanitizer to clean your hands, and definitely use soap and water and wash your hands as often as possible to reduce the risk of infecting yourself and the people that you live with. I wanted to thank you so much for paying attention and giving me your time during this video. If you have any other questions, please feel free to reach out. We're here to help you as always. And thank you for being part of our community.